Hey guys, today I'm talking with Glena Cheng. Glena is a pulmonary and critical care physician, and she has her master's in health policy and law. She's on the front lines for this pandemic and has a really unique perspective, both from an ICU doc, but also from someone who's involved with healthcare policy and what that means for all of us. So definitely check this video out and let us know what you think. Okay, so how you doing? Thanks for being here, Glena.
Good. I'm good. It's good to be at home. So yeah, it's great.
Yeah, I can imagine. For everyone out there, Glena is a pulmonary and critical care physician. And obviously, she is right in the ring of fire right now. So I'm really glad that we're able to talk to her today and get a first person perspective on what's going on here with the pandemic. So, Glena, I know you were a physician for about 12, 13 years or something like that, and then decided to go back to school. Can you talk a little bit about what that path was like and what the catalyst of making that change was?
Sure. So I was in nonstop school from, until after college. There's medical school, there's residency, there's fellowship. And then I started working and worked about 12, 13 years. I said, I think I need to learn some more. I was so comfortable in the student position for so long, but what I was seeing is that there are a lot of people making decisions for healthcare professionals who really didn't understand what was going on in the front line. And for example, when Obamacare was, signed in 2010, over the next few years, we saw from a clinical standpoint, an influx of patients who were finally able to receive the care that they'd either been neglecting or unable to receive because they didn't have health insurance. And although it was overwhelming from a clinical standpoint, because we had so many more patients without an influx of more providers, it was really rewarding because we could actually help people who had no access before. I'm particularly sensitive to this issue because I'm the child of immigrant parents. My parents owned a sandwich store when I was growing up, and there was no money earmarked for health insurance for my parents or for myself or my sister. So one of my biggest thing is, when I become a doctor one day, I'm going to make sure that I can help people in the same way that, my parents were able to, they miraculously somehow got through, the majority of their lives without health insurance. But that was a big safety net that I felt was lacking. And I wanted to see that not happen to other families. So that was a lot of, the lack of health insurance was a big thing that in my growing up. And then to see the dismantling of the ACA or Obamacare was really frightening when we had new leadership come in 2016. So I just felt like, even though I really enjoyed, and I feel honored to be able to work with patients and family members at the bedside, I felt like I had a greater duty to use what I learned as a physician and what I learned as a child who didn't have healthcare insurance to make changes to, again, improve our nation's health. So that prompted me to need to have more skills besides my bedside skills to understand how health policy is made, what legal implications there are of different decisions. And that took me back to school for a year.
And I want people to understand the weight of that. I mean, the bedside responsibilities, I mean, it doesn't sound as important as it really is. I mean, being a pulmonary doc, to me, I mean, at least from what I understand from my perspective, is there's a lot of weight on your shoulders already. So to be able to carry that other mantle and feel the responsibility of healthcare at large and not just your day to day, I want people to understand how monumental that is. Can you talk a little bit about what that means to be a critical care doc and a pulmonary doc, and just what that title kind of represents, so that people can understand when you put the responsibility of understanding the policies around it as well, they can.
Sure. So I'm trained, as my colleagues are, to care for critically ill patients in the ICU. Most of us ICU physicians are also trained in pulmonary medicine because one of the mainstays of critical care medicine is learning how to manage ventilators, which involves the lungs. So we use the term pulmonary critical care very interchangeably. But again, our main task is taking care of the sickest patients in the hospital, as well as maintaining a clinic of patients who have various lung issues, whether it be emphysema, fibrotic lung disease, lung cancer, et cetera. But again, I think it's really interesting because I think a lot of us become numb to the seriousness of the ICU because we walk in there every day.
Yeah.
But it's a really terrible place to be, a terrifying place, I guess I should say, not terrible, a terrifying place to be as a patient, as a patient's family member. And having been on the other side, not being the physician, but being a family member of someone's ICU, you realize how dependent you are on the communication of the doctors, the nurses, the respiratory therapists, the social workers to understand the process of your illness and your treatment, because the mortality rate in the ICU is very high, even in pre-pandemic stages. That's, again, if you're in multi-organ failure from your lungs failing, from your kidneys failing, from your liver failing, that's where you go, because that's where we have the modalities to support one's failing organs. So it's very strange that people said, why are you going back to school? You're in a really crazy environment to start. Why are you using this to go back to school? And I think it's because I feel like people don't really understand what goes on in the ICU, the implications of the things, how we communicate. And I felt like that needs to be recognized. And, I guess I felt like I was sort of qualified being at the bedside all the time, instead of having other people who don't understand what we do make those decisions for me and my patients.
Yeah, it's a good point. I see a lot of that in education as well. I think, teachers on the front lines of what education means and how to educate a child. And then when you talk to the people who are actually creating testing, and there's all these external forces that are kind of mandating things that don't work on the
Right.
ground level. So I think a lot of industries are like that, but no more, it's more recognizable and more critical in healthcare, obviously. So I think that's vital what you're doing and how you've kind of stepped up to the plate on that. So what comes with that? So now that you've gone back to school, you've taken on that role. Before we kind of head into some of these other things, I'm really interested to talk about. What does that mean for you now that you have that title as well?
For my day-to-day life, I'm no different as a physician now as I was before in terms of how my patients see me. I'm still the same doctor. I still, do the same bedside care I did before. However, I think it's really interesting is I have a different lens when I'm looking at things now. Observing how our leaders from a local level to a national level, to a worldwide level, how this, pandemic was handled. It's a case study of what you should and should not do. Seeing some of the governors step up and say, absolutely not, you have to stay at home, listening to the science, listening to the frontline, scientists and physicians has made a difference. I mean, we can see that. We can see clearly in California, we're not as, devastated by this compared to New York because we learned from our predecessors. And that's not to say New York didn't do it, but I think they're hit first. So I think learning from how other countries, how other states, how other parts of the state have handled this pandemic, I think that shows good leadership and shows good use of resources. And being able to put partisan things aside, I think, again, it shows that we can make a difference, but you have to be engaged in the process. There's a whole thing that I didn't realize called implementation science, how you make changes. And that was very novel to me when I was learning about it. But then I realized, again, it's using your common sense and listening to the people who have the knowledge to make changes. And I think that's why, again, when I watch right now, I'm very heartened to see things done right, but then I'm very, sad when I see that didn't have to happen that way. And that's even pre-pandemic, watching things, how at the local level, how things are handled in my work environment. Same thing. When people are making changes and they don't ask people who are involved in the changes if that's appropriate, I think that's when disasters hit.
Yep. Do you think the pandemic, I mean, speaking of that, is that going to be the change you think is needed? Is this kind of the wake up call to the people who maybe didn't see things on the front line? Do you think this could create positive change?
I think if you have the right people behind it, absolutely.
Yeah.
I think there's so much denial at different levels. It's really hard to convince people that they have to see things differently. But I think the fact that this has touched everyone in so many parts of their lives, if there's ever an opportunity to, have good things come out of disaster, this is it.
Yeah.
And I definitely hope that people learn from it. But I think we're going to be surprised, at least in our country, how resistant still we are to change, which is a little sad.
Yeah, I mean that's the business I'm in, trying to create common ground, trying to bridge divides, bring people together, and really see that there is unification out there. I think it's just you kind of have to shut off some of that narrative that currently takes place. You have to create new narratives, and I think at that point you're a little more open to change. But we are a slow moving nation when it comes to that,
Yes.
for sure.
Yes.
Speaking of slow moving nation, we're seeing so much now in the news about social distancing and about how people are kind of resisting science and resisting a lot of what's coming out about why we wear masks and why we're 6 feet apart and why we have to lock down at home. I could understand how that feels like a violation, especially in a free nation like this. I think people feel their liberties are being taken away when something is dictated in that way. However, this is life or death, and you obviously see that firsthand. So can you talk a little bit about the importance of social distancing and all that goes with that?
Sure. So again, the social distancing is based on the science of how this disease is spread. Coronavirus is spread through droplets. And again, the whole 6 feet comes from droplets that come out of your mouth, out of your nose when you're talking, usually don't travel further than 6 feet. So that's why 6 feet. And there's no debating that science. It's just, we've known that with the flu, with other viruses. That's why we do droplet precautions routinely when for example, when patients have the flu, the regular flu, they come in, we do droplet isolation for those patients. It's just that the way the flu is affected patients is different from the way the coronavirus. And so again, go ahead.
Sorry, just is that because it's human to human and this was animal to human to human human, or what's the difference there?
For some reason, this virus is a whole lot more virulent in terms of its contagion. The ability to spread the disease when someone's asymptomatic is terrifying. And the prolonged duration of shedding of the virus means that you could have recovered and yet you still may spread this disease to someone else. So I think that's the terrifying part of this compared to the flu, is because we don't know if you may not be symptomatic, but you're shedding the virus and you're contaminating people that don't know. And then even when you're better, you might still be shedding the virus. Yeah. So again, the 6 feet comes from, let's assume everyone has it, even if you don't have symptoms, because it's been shown again and again that the asymptomatic carriers are the ones who are actually shedding the virus and getting their loved ones sick.
Is it fair to say that testing then is the most important thing that we should be focusing on collectively? I mean, obviously PPE and everything else, but if we don't test and just don't know and don't have a grasp of who does, who doesn't, who's just, because of the symptoms aren't obvious, is that fair to say or no?
I think testing is really important, but I think the social distancing still trumps testing. Because again, if everyone just assumes they have it, again, if everyone stayed still and was able to be in a cocoon for 14 days, then theoretically we shouldn't be shedding again, right? If everyone did the right thing for 14 days straight. That's again theoretical. That means you don't have to go to the grocery. You don't have to run any errands. Your daughter can take care of herself, right? and all
she probably can.
She probably could. But a lot of things are based on theory. But the science behind the theory is that, again, this is human to human, no matter how it was initially spread. So again, if you're shedding the virus, even though you may not have symptoms, you can get someone else sick. That person can get other people sick. But again, if we stayed away from each other, and became the virus cleared out of our systems, or we died from the virus, then theoretically we wouldn't shed the virus to each other anymore, right?
Gotcha. Yeah.
And just to give you a more practical way of looking at it, in the intensive care unit, I took care of 2 people who were at the same social event a week prior. So I'm assuming they both got the disease from that social event where there are hundreds plus people.
And this was a social event during the pandemic after
Yes,
knowing that we should be
exactly,
quarantined.
exactly.
Hmm.
And then, the family members I speak to of the patients I'm caring for, a lot of them are in quarantine or they have other family members in the hospital. So it definitely is spread person to person. There's no doubt. I think the trouble people have wrapping their head around the quarantine is that, well, I feel fine, but that doesn't guarantee the person who you possibly can infect will be fine.
Yeah.
Why is one family member in the ICU whereas other people are at home in the family? So I think that's the scary part is trying to think of the quarantine as something that you're not doing just for yourself, but for other people around you.
Yeah. And I feel like that's kind of where the disconnect with the different generations come from too. Cause when I'm seeing younger people out on spring break and,
Mm-hmm.
and some of that narrative too out there by multiple different people and media outlets, kind of pushing that. That's scary to me because I can also understand when you're in the mindset of a 21-year-old on spring
Right.
break, you do feel invincible and you do feel like you're kind of in your own world to a certain extent. And I don't want to paint them as, naive or not smart to what's going on. But I just think circumstantially, it's easier to think for yourself at that age. So what should the messaging be? And how vital is it that young people understand that they are just as susceptible, if not to themselves, to the people that they love around them?
Sure. I think that is absolutely number one. If you want to do something positive, there's one thing to take away from our talk today is that it's social distancing is vital for us to get through this pandemic. And it is not just about you. It's about the people you can potentially come in contact with.
Yeah.
And again, the people that you live with who you potentially infect. And just sort of related to the social distancing is that thought that this can't happen to me. The bulk of the patients I've cared for in the ICU are between ages, their late 20s and 40s, which is very different from what we talk about with risk factors.
Yeah.
So
where is that disconnect though? Why aren't people hearing that?
Right.
And why do you think that is that you're seeing most of your cases in that age range?
I think our older generations are wiser and they're listening more to the stay-at-home mandate, and a lot of our older patients have comorbidities, so they are more terrified. So they will do their part in staying at home so they don't get sick. I think, at least in the population that I work with, it's a more blue-collar demographic. A lot of people still have to go to work because their livelihood, their families, meals and rent depend on that. So they're doing the best they can, but there are other people who may infect them. And it's unfortunate because that's the 20 to 40-year-old, that's the working sort of generations, right? That's the demographic that's out working. And they're not the ones out partying, but they're the ones out there, at LAX, at the supermarket, doing their thing. So I think that for me and my colleagues, that's been a huge shock of the number of young people that we care for who are so life-threateningly ill. And that's we're not used to that. And it's even more, I think, imperative that our younger generations see that and recognize that this can affect them.
Yeah, I agree. And thank you for saying that. And that's, the majority of our demographic too, with Common Ally is younger. And I think it's important that they hear that. So thank you. I want to talk a little bit about post-pandemic, if we can perhaps ever get there. I want to see what that world kind of looks like. But before I do, can you, and I don't know how much you can and can't talk about this, so feel free not to, but I really want people to understand how dire this is and what it looks like through your lens when someone does pass or is about to pass. Like, what is that experience for you know, because from what I can understand, you know, family we can't all go there. You can't send a priest there. You don't have this support group around you when you are at that stage. And by default, I feel like that puts you in that family role,
Right.
and you have to become a de facto family member. Can you paint that picture and just talk about that a little bit?
Sure. It's very interesting because again, my colleagues and I, we're very used to talking about the topics of death and dying, because again, the ICU is unfortunately a very common area where death and dying occurs. Typically, it's patients with underlying chronic conditions, say malignancies, end-stage heart disease, end-stage lung disease, and so the death is not unanticipated. It may not be, of course, it's never desired, but it's not a surprise to patients and their family members.
Mm-hmm.
When we have 20 and 40-year-olds coming in, or even older patients who are fine until they got this horrible virus, it's very devastating to families. It's especially, like you mentioned, family members, no visitors, nothing. No one's at the bedside. And when I see family members at the bedside, I see the anxiety of the patients go down, even if they're on a ventilator, even if they're sedated, just that ability to connect physically and to see your loved one. It definitely allays a lot of the stress that people are going through from all family members, and or even, you know, if only, you know, John can visit grandma. John can tell everyone, you know, who's out of state that grandma's okay because he's laid his eyes on her. Mm. The inability to do that is the strangest thing that I've ever encountered as an ICU physician. You're absolutely right. I've become that surrogate family member. I've become the chaplain. I always call the patient's family member and said, what is it that you want to tell, you know, your son, your wife, because you can't be here? And being part of that intimate discussion it brings me to tears almost every day. But I feel like I have to do that because that's the only connection that the patients and the family members have. When we have discussions about dying, you can imagine that it's hard even when we do it face to face, and it's not a surprise. Yeah. But when situations happen that, you know, things are happening very quickly, it's unreal. The other day, I saw that a patient was deteriorating pretty quickly, and we've seen this where patients are semi-stable and then they quickly, for some reason, this virus has a way of really damaging the conduction system in the heart, and patients literally can flatline very quickly. And as I was having this conversation with a family member, the patient actually expired. I watched the monitor and just the heart stopped. And, you know, this is a situation that I sometimes, you know, encounter, but I can at least say, come on in before I tell the family member, you know, the terrible news over the phone. But because they can't visit, I have to tell them over the phone, which is something we're taught never to do.
Yeah.
So for that one instance, I actually offered to take a tablet in that the family members could say goodbye to their loved ones. It was really difficult, and I really didn't expect to get all choked up because I deal with death and dying every day. But afterwards, I was thinking why it was so hard as I was listening to the family members say their goodbyes and say thank you to their mother, to their grandmother, to their wife. I think what was interesting in retrospect was that even though I am usually present for the death and dying conversation, I'm usually not in the room when family members are saying their goodbyes. And that's such an intimate part of, you know, life that I'm not usually privy to. And obviously, if I did not take the tablet, that would not have happened. So again, it's really a strange time in so many ways, and the nurses are extremely sensitive to it. We try to get family members to, when it's appropriate, to connect via their devices, but it's nothing that anyone's ever prepared to do. Again, I kid you not when I say I deal with death and dying every day, and I'm very comfortable speaking about the process of, the options, the goals of care, but being part of such a such a intimate and tender part of the exchange is really uncomfortable. But, I spoke to our chaplain the other day, and I said, I don't feel right being in there. He's like, but you gave them a gift that they wouldn't otherwise have had. So it's okay that you were there. So I've had a lot of discussions with, our bioethicists, our chaplain, other, physicians and nurses about how kind of we are processing this. And everyone does it differently. And, but I think this will be a lasting kind of scar in our kind of in our psyche, because we are the only person there to be a conduit to patients and their families.
Yeah, that's really powerful. First of all, my limited experiences in the hospital around loved ones and myself, I've always been amazed at how the staff, from nurses on up, have been that rock. When there's so much uncertainty and doubt in your own mind, and even your family members don't really know, you always look to the physicians as you're reading their faces, you're watching their every move, because you're looking for that glimmer of like, am I okay?
Right.
So I could only imagine that you being in that room with an iPad with a loved one who's now watching their family member deceased, I'd imagine that breaks you. And in breaking you, and you break down, I would assume anyways, or have some sort of emotional reaction to that. That's got to be, not to make this weightier than it already is, but traumatizing in a way. And I feel like that brings on mental health issues and adds another dimension to what someone in your position is probably already dealing with. I know you mentioned a long-term effect from this. Is that what you mean when you say that?
Yeah, I think it's, again, this definitely doesn't compare to the physical trauma of war or the psychological trauma of war, but I think there are parallels in our encountering something extremely new where we don't know how to process everything. And we're being relied upon not only to have the medical knowledge, but also the social skills to help families process, to help ourselves as healthcare providers process what's going through. And it's so much, so quick that it's really hard to digest all at once. So I think once, again, like you said, when we get through the pandemic, we may have some time to sort of unwind and kind of look back and figure out, how do we deal with this, and how do we process this? It's really strange to a strange time in terms of family members always thanking us at the end of the conversation. I've had tons of conversations as an ICU physician over the years, and more often than not, we're not thanked. And I am not looking for thanks, but I've been overwhelmed by the thanks that these family members give us. And they always say, thank you, your team, and please stay safe. Like the fact that family members recognize how serious this condition is, and that the fact that, all the people who are taking care of the loved ones are at risk for getting the disease too, also sheds a light on, yes, actually this is really serious. I forget that when I walk in, because it's my job to do this and not to be worried about that. Yeah. But when they start thanking me, it actually kind of gives me a wake-up call too.
Yeah. And I hope that most people don't have to get to that level before they actually do take it seriously, so we can mitigate this as much as possible. Before I do move on to the post-pandemic era and what life will look like and what the healthcare system will look like potentially, what has this experience been like for you as a daughter, as a woman who is, take physician off of it, just as a human being, right? Like, what does that look like for you?
Yeah, it's really interesting, because when I walked into work, I'm, full on ICU doctor. And then when I change my clothes and I walk out, I'm like, okay, do mom and dad have groceries? Is everyone safe? It's a different kind of shift, but the work stuff continues to haunt me as I'm driving home, as I'm sleeping. But then when I walk out of the hospital, the fact that I realize like I have other things in life to worry about is a little eye-opening. And I trying to convince my parents that stay at home really means stay at home is hard because they're my mom and dad. They know better than they don't trust their ICU doctor daughter. She doesn't know anything. So yeah, it's a challenge. And I remember in early March when I told my parents, I said, this is the last dinner I'm going to be having at home with you guys. And it made me really sad. But I knew that, going forward, that the numbers are rising in the intensive care unit, and that I could not put my parents at risk because I'm constantly exposed every day.
Yeah.
And they're like, why are you so silly? If you're not working today, you can come home today. I'm like, no, but it doesn't work that way.
Yeah.
The virus is still around, the 14-day thing. So it's been challenging to still be a daughter role, yet, make sure that my parents adhere to the science that I'm preaching. But as any parent will vouch, they always think their kids are going to starve. So I will go home and pick up food. My dad will leave outside, close the door and wave to me as I'm, leaving. I will randomly find food from my parents or my neighbors or friends on my porch when I come home, along with notes and flowers. I mean, the goodness that has been shown in this pandemic is also overwhelming.
Yeah.
And yeah, so it's amazing. I got a letter from a fourth grader the other day saying that I was his hero. It's amazing. It's again, the good that has come out. I do Zoom baking sessions because I love to bake with my friends to humor me because they know I have a sweet tooth. So they'll do that to help me maintain my sanity. Virtual exercise, sessions with my friends so that, I sort of stay sane. So again, the outpouring of support from the community has been really amazing. And they know that what I'm going through is pretty unreal. So they've done everything that I could ever imagine a friend or family member could do.
Yep. No, I think first of all, it's really heartwarming just to hear like the human side of things outside of the hospital, and that you are like us. But it's also, seeing the 7 o'clock cheers in New York and seeing, people actually really look at this from, like you said, an actual genuine place of gratitude, I think is really nice to see. One thing though, in counter to that a little bit, I saw this meme, which was, thanks for the cheers at 7 o'clock, but can you please just start voting for people who create policy that you don't have to cheer for anymore?
Yes.
I thought that was really powerful. So I think both would be nice if people can really understand, but I also understand the healthcare system is very complex. And I think the solutions to the healthcare system is complex. So, getting that to a digestible level for the everyday person, I think is really important and part of how we kind of transcend this roadblock we keep hitting between universal healthcare and single payer and private healthcare, all of those together. It's hard to navigate, I think, for the everyday person. And I'm sure that that's in your head when you're thinking about this as well. I know we're kind of coming up on time a little bit, so I do want to talk about, I want to get some advice from you, of course. But before that, say the pandemic ends mid-May or June or whenever that ends up being. And by ends, I just mean we can somewhat regain some normalcy to our life. What can that potentially look like? I've heard of some like intermittent quarantines and schools maybe taking a month off each year and, kind of on and off on when we do some self-quarantine and to lighten that load a little bit. Is that feasible? Are there other solutions? Like, how do you see us coming out of this in a reasonable way? Not to go back. I want to kind of be clear about that. I think we should take this as a wake-up call of like look at this internally of how we got here in the first place. But how do we move forward?
Great question, Aaron.
And you don't have to solve the world right now.
No.
Just a few notes on it.
Every day has been a new learning adventure for me and my colleagues in just the treatment of COVID-19. And I look into the future and I'm actually unsure of what it's going to bring us. The intermittent quarantines, I think it's a great idea. And I think we're going to have to do it, but I can't wrap my head around it yet, because if the experts out there are not even sure, I don't think I'm even qualified to even, discuss what they think. The surge, the peak, those are smart people predicting the numbers. And I think I'm a little overwhelmed in trying to figure out what the future brings to us.
Yeah.
That's not the right answer or the answer you're looking for, but
No, there's no right answer. This
but
is,
I yeah, I think it's going to be it's going to significantly impact our lives. Going to the market's never going to be the same. Going shopping, walking at the beach, I don't think any of us will be quite as carefree as we were before.
I'm in Santa Monica, and
Yeah.
I'm seeing quite the contrary.
Oh,
People think it's summer of 2 years ago, apparently,
yeah,
but
yeah,
it's maddening.
it is.
Okay, let's talk about a few points of. I know you talked about social distancing, the importance of that, the importance of young people really understanding that they are as vulnerable as anybody else. What are a few major takeaways for people listening
Sure.
on what the impact could be here and how they can go about this?
Right. So I think when I look at the big picture, even though I can't predict how our lives are going to be, I definitely see a huge gap in our nation's kind of infrastructure, and that's the big thing is the lack of a universal healthcare system. Again, despite my spending a year in health policy and law, I'm not sure which is the right system, but I can tell you that having a system that provides people healthcare, regardless of your socioeconomic status, is vital. The U.S. has spends the most per capita of its GDP on healthcare compared to all the other countries. But we don't have universal healthcare, and our health outcomes, from various markers, whether it be infant mortality or the age at which we pass, our metrics are all lower compared to other countries. So we already pre-pandemic were in a bad situation. And with the dissolution of the Obamacare in multiple states, there's no individual mandate. So people who had a chance to have healthcare are not going to have healthcare. People who had jobs that connected them to healthcare are no longer have jobs and no longer have healthcare. So to me, there's a really, really big gap that we're going to have. And how do we get all those patients who had healthcare and the patients who don't have healthcare into a safe place so that they can take care of themselves? And like the meme you said, yes, let's just get people who can actually make a positive difference and not undo what progress we have made. Again, Obamacare was not perfect, but it certainly was a step in the right direction. And change takes time. It takes little incremental changes. And I think that going forward, we still have to make those changes. And everyone has to have the foresight and the selflessness to say, it's okay if I may have to contribute to someone's healthcare, because in the end, it's going to be better for all of us.
Yeah, that well said. And that's the part that I think more people need to understand. And I don't know what's right or wrong either. Like, this is certainly not my wheelhouse, but I would imagine that the more people who have coverage, the less economic impact, negative economic impact that's going to have on society,
Right.
because we end up paying for that anyways.
Right.
So to me, if we could be a healthier nation, there's
Right.
less healthcare costs. I mean, that to
Absolutely.
me seems simple enough. I don't know if that's correct or not, but if it is, I think that's the case to make. And I think that needs to be framed in that way. And I don't think the conversation is being had yet like that.
Right.
It
Right.
is in some places, but I think not universally and not widespread. So maybe that's part of the work we have to do on our end here. But Glena, thank you so much.
Yeah.
I know we have a lot more to talk about, and maybe we could do a follow-up, and because I know there's a lot more to talk about, but this has been incredibly eye-opening for me, and I'm sure for everybody watching and listening. So thank you so much for your time.
Thank you, Aaron. Thank you for having me. I appreciate it.
Of course, stay safe.
Thank you.
Yeah, and stay sane, and
Absolutely. We'll
and
try.
thanks.